Welcome to Module 6.8, Media Environment and Health Information. In this session, we'll explore how the evolving media landscape shapes the communication of health information. Understanding the media ecosystem is essential for researchers seeking to effectively share their work in today's complex information environment. We'll examine the characteristics of the contemporary media landscape, major sources of health information, and specific challenges facing public health communication. This understanding helps researchers develop communication strategies that can successfully navigate the current media environment to reach intended audiences with evidence-based health information. Today's media environment presents a complex landscape for health communication. Traditional and digital media convergence has blurred boundaries between formats, with print, broadcast, and online platforms increasingly interconnected through shared content and cross-promotion. Social media dominance has transformed information flow from primarily top-down to more networked and peer-influenced, with platforms like Facebook, Twitter, and TikTok becoming significant sources of health information for many people. Information abundance and overload means health messages compete with unprecedented volumes of content, making attention a scarce resource and retention challenging. Declining journalism resources have reduced specialized health and science reporting at many outlets, sometimes leading to less context, nuance, and expert validation in health coverage. Audience fragmentation means health information consumers increasingly occupy different media ecosystems with varying norms, trusted sources, and content exposure, complicating efforts to reach broad populations with consistent messages. These characteristics create both opportunities and challenges for researchers communicating health information in today's media landscape. Health information reaches the public through diverse channels with varying characteristics and credibility. News media coverage remains influential in setting health agendas and explaining complex issues, though quality varies significantly between outlets and coverage often emphasizes novelty over context. Social media content ranges from evidence-based information shared by credible organizations to misleading content promoted through engagement-driven algorithms, with both health authorities and influencers shaping perceptions. Government and organizational communications provide official guidance through websites, campaigns, and direct outreach, though trust in these sources varies across population segments. Direct-to-consumer health marketing from pharmaceutical companies, health systems, and wellness products significantly shapes public understanding, often emphasizing benefits over limitations or alternatives. Community and peer information sharing through personal networks, online communities, and word-of-mouth plays an increasingly documented role in health decisions, particularly for marginalized groups with historical reasons to distrust official sources. Understanding this ecosystem helps researchers identify appropriate channels for different messages and audiences. Public health communicators face several significant challenges in the current media environment. Competition for attention requires creating content that stands out amidst entertainment, news, and personal sharing without compromising scientific accuracy or resorting to sensationalism. Misinformation spread through social media and other channels can rapidly undermine evidence-based health recommendations, requiring proactive strategies for correction and inoculation. Complexity simplification involves translating nuanced research into accessible messages without oversimplification that distorts meaning or omits important caveats. Risk communication difficulties arise when conveying probabilistic information to audiences with varying numeracy levels, particularly when uncertainty exists or when individual and population level risks differ. Scientific consensus representation becomes challenging when media norms of balanced coverage present established scientific agreement and fringe positions as equally valid, creating false impressions of controversy. These challenges require researchers to develop sophisticated communication strategies that maintain scientific integrity while effectively engaging audiences in today's media environment.